Hey guys, what's up? We are now live in the 5-day EKG challenge for day 5. I'm so excited about day 5. You guys made it. You've been hanging in there with us. We've been seeing you show up and put in the work, and we're so proud of you. So, tonight, as a reward, we have a game that our game hostess has put together. Now, she did some of this game last night, so if you got to see that, we're going to kind of continue on that path. And while you guys are getting ready to do the game with Michelle, I'm going to give you the hashtag that we're going to do. I'm going to give that to you early tonight for the winnings so that I can, while Michelle's live, I can write your names in my card box and we can draw them at the end. So it'll be perfect. So in order to enter the drawing tonight for the prize, Michelle has 3 mug rugs that are truly cute. Do you want to show them again, Michelle?
Yes. So everybody that's on the live, I've got it up on Facebook too. So I've got 3 mug rugs. This is the cute one here. Do you need a paramedic? So people that are paramedics might like that. The back of it has cute little kitty cats on it. These are I call them mug rugs. We use them for decoration or put your coffee on or whatever. What do we love? EKGs. It's got little hearts on the back. And then I've got 2 of them that someone called for a paw medic. Got 2 of those, and they have the same kind of backs, little puppy dogs on the back. So I've got some more that I'm making, but I've been in a retreat all week, so I just got home a little bit ago, so I'm in my closet.
Yeah, you haven't seen Michelle in her closet yet. Well, if you're in the 30-day, you have. But she's got lots of fun things. She uses all these tools in the 30-day EKG challenge. You will get to see her use all the things. And the other prizes we're giving away tonight are some more of these badges. I'm trying to get the glare off, but these badges are so cool. They've got the red line, the measuring, and so we'll be giving some of those away tonight. So the hashtag to win, to be entered, go ahead and type it in now, is 30-day EKG. 30-day EKG is the hashtag, and that will get you in the running for the mug rugs and the little badges. So without further ado, I'm going to turn this show over to our wonderful coach, Michelle, who's going to take you through a game, and then I'll meet you back, and we will do night 5 of our 5-day EKG challenge. So excited. All right, guys.
Okay, guys, I am gonna share my PowerPoint, and so I have it as a game that I showed you last night. And here we go. So it's Who Wants to Be an EKG Millionaire? And so this is, here we go. Oops, you know what? I opened the wrong one. Oh no. Oh my gosh, I opened the wrong one. Let me go back to my PowerPoint. I apologize for that, guys. I thought I had everything ready right here. And I opened the wrong one. Need the one for October.
That's why I start early so people have a chance to get their tech up because it's now
I know.
still on time.
Oh, okay. Okay. All right. So I saved it and now I can't find where I put it. Let's come to my.
If you can't find it, I can start with our 5-day if you want.
Yeah. Just give me 1 second. Okay. I'm sorry, it was laying right here.
And remember, guys, if you're just joining us, if you want to win the badges, the prize tonight, we're doing the prize a little bit early. So you're going to put hashtag 30-day if you want to win the badge. I'm actually writing your names. See, you can see I'm already writing your names. They're going in my little heart bowl. So as we go, I'm writing them down. So put hashtag 30-day. I got you, Anna and Chaz. Michelle, do you want me to put mine up? Are you?
No, I've got it. Yeah, I did some changing on it, so that's why I wanted to make sure I got the right one today. So, because I made some question changes and I wanted to make sure y'all got the newest ones. Okay, so here we go. All right, so let me get my chat back up so I can see you and answer the questions. All right, so I know y'all are still typing in the chat, but if y'all are in either live in Zoom or live on Facebook, type in the answer to this one. So this one's a twist on what we said last night. If you have a P wave for 100 points, if the P wave, like we said last night, was atrial depolarization, then what would you say the QRS is? If the P wave is the atrium depolarizing, then what would you say that the QRS is representative of? Let me see where I've got. Yep. Everybody's already answering. Awesome. So Monique, now K Craft. I'm not sure of your name, and
Oh,
Susan.
Kaylee. Haley.
Oh, Kaylee. Okay, and Marcy. Oh, D. Yes. So ventricular depolarization. Yes, you are correct. So for 200 points, we're on a roll now. Which node functions to create a normal conduction delay in the EKG? So when we start talking about any kind of blocks or anything, this node is super important. So for 200 points, and this is back just a little bit on our review stuff, but what do you think on this? Which node functions? Yes, I have a bunch of A's on that. Yes, the AV node is the one that's actually causing the delay. And I like to say, it says, stop, we don't know what's going on. But the AV node looks around at the ventricle and says, hey guys, are you ready? And then it allows the electricity to go from the sinus node onto the AV node. So that is for 200 points. Okay, for 300 points. And we got a lot of people in Facebook. Amanda, Heather, Yusheen, a lot of people that put in the answer for that. All right, so 300 points. Let's get going here. If you, Jennifer touched on this a couple times. You would expect the 12 lead, so this is for 300 points, you would expect the 12 lead to show inverted T waves in 2 leads. Which leads would you expect that in? And we've got, yes, y'all are so fast typing. I'm trying to get the answers up here. I can't even see them fast enough. So yes, I'm looking at the chat. Yes, several people are in there saying D, lead AVR and V1. So in AVR and V1, which are looking from the right-hand side, you would see that those T waves would be inverted, and that's normal. Okay, so we're a third of the way onto our 12 lead. Yes, and I've got a couple people in chat also saying that. Jackie, Yusheen, yes, y'all are getting it. So what do you think about this rhythm? For 500 points, I'm sorry, for 1,000 points, what do you think about this rhythm? What do you think? We've got AFib, VTAC, SVT, second degree heart block type 2. What do you think about this? I've got a couple people here, Susan, Kaylee, Amar, and I'm looking in the Facebook, give them a chance to answer. Candace, yes, it looks like everybody has that one, and it's AFib. There we go. My computer has a little lag here tonight. All right, so here's a 42-year-old male, and as Jennifer likes to say, this is one of my favorite rhythms, or my favorite, not rhythms, my favorite things to look for, because I really had to, at the beginning, kind of had to struggle to figure out how to remember this one. So this guy's coming in, he's 42-year-old male, syncopal episodes times 3 in 24 hours. What do you think about that? I'm showing you in V1 and V2. In V1 and V2, we're looking for something. And yes, oh, there's so many people on Facebook that got that one right. They're like so fast. And it is Brugadas, yes. There we go. And I love that one. I've got the little skier girl coming down there. And as if you need a remembering, the way I remember it is, brr, it's so cold in the V-leads. Brr, I'm going to be skiing in the V-leads. And that's how I remember it. Plus, we always say nothing ever happens good in the V-leads. Okay. So, this one we talk about quite a bit in the 30-day class. And David really emphasizes that if you don't put the leads, especially V1 and V2, where they're supposed to be on the patient, especially V1 and V2, if you don't put them in the right place, what are you looking at? And I like to use a camera analogy when I'm teaching the basic class, and I always tell you, if you don't put the camera in the right place, I don't know what you're taking a picture of. If the camera's someplace else, I can't tell you what normal is. So normal V1 and V2 should be where? And I've got Marcy. Yes, y'all are on top of it. And in the chat, I'm looking on Facebook too. Yes, everybody has that. It is the 4th intercostal space. And you really have to count down on those ribs and find out exactly where that fourth intercostal space. And I like to say that on most people, obviously you're going to count, but on most people, it's about nipple line and mid-clavicular is where you want to be looking. So you need to look at those places in the right spot. I'm sorry, not mid-clavicular. V1 and V2 are going to be on either side of the sternum, but it's going to be fourth intercostal space. Okay, perfect. All right, so let's see. For 8,000 points, which coronary artery perfuses the septal and the anterior region of the heart? And I have a little heart here, if you can see it on Facebook. It's my little heart, and I actually make all these. So the anterior and the septal area of the heart, that's the front of the heart, the anterior. So which coronary artery perfuses that anterior aspect of the heart? Yes, Chatri and Marissa and Candace. Oh my gosh, Marcy, Amar, and Kaylee. Yes, and the LAD is, there we go. The LAD is what's perfusing the front of that heart. So right down here on the front of the heart. And I have lots of different hearts, as you can see. I like lots of hearts. And big ones so I can really see what's going on. You can tell I like to sew, right? All right, so when I start talking about the coronary arteries, I like to also remember about the back of the heart, because poor little back of the heart, nobody cares about him. It's so sad. Nobody even thinks about him. So we have to worry about him. Which two coronaries could have occlusions in them, and they are the ones that could be the perfusers of the back of the heart. You have two coronaries that go around to the back of the heart and perfuse the back of the heart. Yes, Amar. Boy, you typed that in fast, Amar. Let's see who else is typing in here. Yes, the RCA, or excuse me, the RCA and the left circumflex. So that RCA, when it comes around, it normally perfuses on most patients the inferior aspect of the heart, but there's a little branch that comes across and perfuses the back of the heart. And then we also worry about that left circumflex. It comes around, and in patients that are left dominant, it could be the one that's perfusing the back of the heart. So we don't know who's doing it. We just have to think about that aspect of it. Okay, so here we go for 32,000 points. And I want you to think of a word here. We use this word a lot, and we're making sure that you know all these words. So when you hear them and people talk about them in cardiology, you'll know what they're meaning. So you're seeing ST elevation in leads 2, 3, and AVF, and that's going to be down here at the bottom of the heart, the inferior aspect of the heart, 2, 3, and AVF. We have these leads, and they're all saying the same thing. What do you call that when a group of leads are all looking at the heart and they're all saying the same thing? What do you call that? What do you call that? What would we call that word? So I'm looking for a word. Yes, Marissa, you are a fast typer, girl. Oh, I'm not sure how to say that. I'm going to say joy on that one. I'm really struggling on that pronunciation. I apologize for that. But yes, this is contiguous leads. So the leads that are looking at this area of the heart down here, when they are down there looking at it as a camera angle, they are saying, we're all contiguous. We're all looking at the same thing. We might be looking at it a little bit different direction, but we're all looking at the same area of the heart. So the same area of the heart, we call that contiguous. Okay, so I'm not trying to trick you on this one. I want you to look at the, for 64,000 points, I want you to look at the numbers at the top, and I'm going to read them off in case that's too small for you to read. Ventricular rate's 88. The QRS is 80 milliseconds wide. The PR interval is 146 milliseconds wide. So, and the QTC is 417 milliseconds. And the axis is at 17. So what would you say about that? Do you see anything with that patient? Do you see anything with that patient? Oh, David's on? Yes, Ken folks. Yeah, we like to say the sisters are all talking the same thing, or those kin folks are all looking at the same area of the heart. Lots of different ways to look at that last one. So, do you see anything on this one? Oh yes, Kaylee, perfect. This is just normal sinus rhythm. It's a normal EKG. Nothing's going on with that. I just want to let you know where your eyes should be looking on this. Okay. Okay, so we only have a couple more questions here. For 125,000 points, what is your interpretation? Where do your eyes go on this? Where is the big bad wolf on this one? This one's not even a zebra, Jennifer. This is just a big bad wolf. Where do your eyes go on this? Which leads are the bad ones? And what would you call that? Amar, yes, Amar has it. Kristen has it. And on Facebook, yes, this is a anterior septal wall MI. And I'm just going to make a little red line here, just super quick. My V leads, V2, V1, V3, and I'm not super good at drawing lines. On with my finger, before all the leads over here, the whole front of the heart. You're going to have to worry about that whole front of the heart there that is having a heart attack. Okay. Oops, I want to end that.
Oh, I think Amar raised his hand. Amar, are you raising your hand?
Did you?
No?
Did you have a question?
Okay.
Okay. Or you can type in the chat if you want, or come off of mute. All right. So on this one, so we only have 3 more questions for 250,000 points. What do you think about this one? Which coronary artery? So I went from looking at that anterior wall, and now which wall of the heart are we worried about here? Which wall of the heart are we worried about here? I love David when he adds in all the other stuff to our things too. Yes. Okay. So Amar, yes. Kaylee, yes. Robert and is on Facebook Live. Yes. The possibly you are looking at the left circumflex. So we're looking at that lateral wall of the heart on this one, and we're seeing it in lead 1. And ABL, in lead 1 and ABL specifically, we see some ST elevation. And as Jennifer reminds us, we only need 1 millimeter of ST elevation in those leads to say that we are having, to call that STEMI, and then we would see reciprocal leads. I didn't talk about reciprocal leads on that one. This was for 500,000. Jennifer talked about this last night. What do you think? And I gave you some little zebras just to get your eyes in the right spot, because sometimes it might be something that's easily missed. What would you think about this one? And I've got a bunch of people. Oh, Jennifer, you got it. They are so smart. They remembered from last night. So this is Holcomb. And this, you really have to watch for this because it's very subtle in the EKG. I mean, if you're not recognizing that these patients can have something serious and then follow up on that, this can be very, very serious on those patients. They can go into a cardiac arrest. David says, icicles and daggers. Yes, those stabbies, all those Q waves. Stabbies. Lisa likes to call it stabbies. Okay, this is for 1 million points. This is a new one. Who is this person? I usually get a lot of paramedics that know the answer to this, and not a lot of other people know the answer to this. But tell me if you know who this person is in EKG land, in EKG world. Does anybody know who this person is? Jessica says B. You are fast, girl. I think you're one of the first ones. Kelly also, I think Kelly typed in there also. Y'all are quick. I have seen that not a lot of people know the answer to this one, but this is actually William Einthoven that was the one that got the Nobel Prize for EKGs, and I thought that was pretty cool. All right, that is it, guys. Y'all are EKG millionaires.
Woohoo!
And I hope you like that I put in some new questions this time. So keep
Yes,
me on
Michelle,
my toes.
we can tell that you brought the fire for us as usual. And David with all his pearls too. This is just awesome. You guys are amazing at all the answers too. So I've just been watching you and loving it. And so we're going to go ahead and keep that momentum that Michelle started going. And we're going to finish off with day 5, and then we're going to give away the prizes. So I have all your names written out in my bowl. Thank you, Michelle, for giving me the time to do it. But we're going to talk about this case, and I kind of hinted at it a little bit earlier on this case of something that's going to really scare you. But this case is meant to kind of shake you with love a little bit, to kind of show you that, yes, we made some momentum in our EKG challenge, but also to show you that there are some things out there still that are really out there waiting to bite us. And this case demonstrates that it's a real case. And I'm going to share with you all the things. But before we do, I just wanted to make sure that now that it's night 5, we're going to be dropping a link for you tonight in the group. And this is going to be a link where you'll fill out a post test and an evaluation, and then we'll get you your CE. Give us some time to get that turned around once you fill it out, because we do have 15,500 people in this group. So it can potentially take us a while, but we definitely are going to post that. So make sure if you can get CE that you want it, that you apply for it. And this is our case of the night. So real case, yeah. So there's so much more out there, lifelong learners. Yeah, David, who you got to meet earlier in the week. Both David and Michelle are coaches in our 30-day EKG challenge, which starts Monday. And David has a class next week. So does Michelle. So do I. And we are dedicated to making sure that you are all safe providers. This is just a drop in the bucket, right? It's some good stuff, but it's a drop in the bucket. But before I go into that, let me just share with you this case. So this happened before COVID. And the reason why you know that is because this patient was in the urgent care and actually got in, right? Because she would get a COVID swab and not be let into the ER or urgent care now, right? She'd be told to go to the ER. But as you can see, we're going to take her into the ER. And the worst thing I think that we all dread more than anything is missing something. And cough is one of these times where we can miss things, especially when we all have COVID on the brain. And I really feel like that even before COVID, this would have been missed. So hopefully after tonight, you won't miss this finding anymore. So here she is. Here's her EKG. So let me just back up. She's a school teacher, and she comes to the urgent care with a dry cough for a week. She's got a little bit of lower extremity swelling. And she says, I have a wedding this weekend. I just need to get better so I can attend my wedding. I need that thing that you gave me last time. I think it starts with a Z. Does anybody have any guesses of what that might be? The medication with a Z? So they're like, okay, well, let's do a quick chest x-ray on you, because I don't know, that sounds kind of weird. Your saturations are normal, dry cough for a week. We should really just make sure you don't have an infiltrate. So they do a quick one view on her. And vitamin Z pack, yes. Heather and Amanda know the trials and tribulations very well. So the x-ray, they look for any heart enlargement. They don't see any significant heart enlargement, but they do see what they thought was an infiltrate. So they said, we should send you to the emergency room. So let's send you to the ER. Now, Robert said, quite astutely, that he's also concerned about pulmonary embolus. And Robert, that is a very, very real possibility, especially with her tachycardia. So a scary tracing and real easy to miss. David is so spot on with that. So yes, vitamin Z, exactly. And so they convinced her to go to the ER, but they've already pre-framed the ER by saying she's got an infiltrate. So she comes to the ER, and thank God for nurses. A nurse was the one that really made sure this lady didn't fall through the cracks, because she got an EKG, and I talked to the provider later. He was not going to get an EKG on this 38-year-old cough. So they redo the chest x-ray, and they have this EKG, and they're like, well, it's not normal. So what do we do with that? So let me ask you guys, do you see anything that stands out as abnormal for you? Now, this is, of course, I saved it for last, day 5, because literally it is a very, very subtle thing. And I wouldn't want to scare you with this in the beginning, right? That would be bad. But it is something real. Now, when you do your 10-step system that you learned on day 1, you would pick this up, because on step 5, I believe it's step 5. Actually, let me go back. You would do something where you sketch out the ST segments, and you would check to see. I'm having a hard time with my mouse pencil tonight. You would start to see that there's a little bit of ST depression that starts forming when you're looking at the segments. And when you see that, I'm just going to say that there's one thing you really want to worry about with that. And when I see ST depression or elevation, I always get concerned about ischemia. Now, this lady is going a little fast. And when you go a little faster, this phenomenon can develop. And if you've ever heard the term demand ischemia, that's what this can look like, where you have a widespread picture of depression with a little elevation in AVR. But that's not what's happening here. It's not fast enough. And in the setting of concern for ACS, this finding is very concerning. Now, Michelle actually has a favorite lead. She has a favorite finding and a favorite lead, and her favorite lead is AVR. And AVR is actually the star of this show, the hero of the story, because it's AVR that we look to next. And when we do, we find at least one small box or 1 millimeter of ST elevation, right? David said that's not what's happening for sure. So when you look at the CKG and you see the ST depression spans across multiple contiguous areas, you know that it's not isolating to one artery. But then what do you do with that? The answer is to, when you have widespread depression, to go back up to lead AVR and look and see if it has more than 1 millimeter of ST elevation, which it did. So with that being said, this is a finding that is significant for a severe LAD occlusion. And that is something that we cannot afford to miss. So literally the thing that I want to shout on the rooftops from every single rooftop for every provider to know, because it's so high risk, is this finding. Now, when the machine says non-specific ST2 wave abnormality, this is just one of the patterns we should look for. There's actually 4 more that also the machine will not call, that also are the LAD screaming out to us that there's something wrong with it. I like to say that the LAD is a big complainer, because there's lots of different ways that it can tell us that it's suffering. This is one of those ways. But before this class, I'm pretty willing to bet that a lot of you didn't know this finding. And that literally breaks my heart, because here's the reality. You're not learning this very important, crucial material anywhere else. And the reason why is because a lot of people don't know this. So it's David and my mission. We go and we find these high risk patterns, these things that are not STEMI but should be treated like one, and we teach them to you because we feel like it's that important. Okay, we want you to win. We don't want you to lose your license because you didn't know this. And unfortunately, when you say, I'm sorry, Your Honor, I just didn't know, that's not a good enough reason, right? The patient still dies, you still lose your license. I'm sorry, I didn't know isn't good enough. And it certainly isn't going to be good enough for you to sleep at night after this patient went home and died because you didn't pick it up. So this finding is something I want you to burn into your mind. I want you to start really going in and measuring for real this time the ST segments. I want you to see if there's depression. I want you to see if there's elevation, because this patient, the one that had a pneumonia, it wasn't a pneumonia. It was actually a pleural effusion, which was caused by heart failure, which was caused by her significant coronary artery disease. Okay, so here was the blood work that would have told you what's going on, hopefully, if you thought to order it. But to be honest with you, I'm not really sure that a lot of you would think about a BNP, especially if you're in primary. And honestly, in the ER, they really discourage us from ordering it. So it kind of gets burned out of your mind. But in this case, this is where it's completely appropriate to order it, because this helps you solve the case. And if you're in EMS and you don't know what a BNP is a marker of heart failure. And this is really super high. And one person I showed this case to this week where I was teaching, yesterday actually, at a PA school, she came up to me and she said, it was a very good question. And I was so impressed with her for asking it. She said, Jen, I like that you're teaching this and this is all great and wonderful, but she goes, the troponin wasn't elevated. I said, exactly. She said, well, then how is it coronary artery disease? And I said, because not everything is going to raise your troponin. This probably happened earlier in the week acutely and sent her into heart failure. And now the heart failure is causing her lower extremity swelling. And the heart failure is caused by her severe LAD and RCA disease that was basically choking out her heart. So it wasn't getting enough oxygen. And her EF, her ejection fraction, was 20, which is very low. Now, Robert, they did a CTA. They looked for a P, but she didn't have one, right? And so David also adds a couple great pearls. See, this is why David is the Mandalorian of our universe. He said the ST elevation in AVR that has more elevation in V1 than LAD, multi-vessel, which this is multi-vessel. And yes, and also it could have been the opposite, right? Like David said, troponins are often not detectable in the first few hours, but we don't hang our hat on the troponin. And the other thing we don't ever hang our hat on, believe it or not, is a solo stress test, okay? I've seen stress tests be wrong. And I'm not saying any of this to scare you. I'm just saying this because if this is the last night that I get to spend with you and you don't decide to hop in with us in the 30-day EKG challenge and continue to learn these high-risk things, then I'm hoping that at least you'll remember this finding and you'll remember this story and you'll be like, wow, I'm really going to be suspicious of the ST segment depression from now on. And I know that when I see that, I'm going to go look for elevation in AVR because I don't want to refer to cardiology that patient. Because honestly, in a busy practice setting where we're all overwhelmed, this could have easily been missed. Why did a 38-year-old have multiple vessels occluded? Why? Well, it turned out that her sugar was high. Okay, she didn't know she was diabetic. And she also had something called familial hyperlipidemia, which makes you at risk for young disease. So the moral of the story is that this lady had a very high cardiac age and a very low chronological age, and they didn't match up. But she didn't complain of chest pain, so therefore it wasn't ACS. Well, we know that women and diabetics don't present typically, right? Atypical is the new typical. So keep that in mind when you're dealing with females. Keep that in mind when you're dealing with patients in general. And the big thing that I really want you to take home on her is when she came in, she said, you know, I'm also tired. If you're on this right now with me on Zoom or Facebook, if you're female, if you're not tired, can you put not tired in the comments? I just want to see, I want to take a little survey. If any of you are not tired, because here's what I know to be true. And maybe one or two people might say not tired. And if you are, I want to know your secret. I want to know your secret. Okay. Because unfortunately, as women, we all just run tired. It's just our normal operating every day-to-day thing. It's why we drink bangs in the afternoon. It's why we drink Starbucks, maca, frappa latte, chinos, right? It's because we're all tired and doing too much. So if a female comes into you, you ask the female, how is this different from your normal tired? And she said, well, it's different from my normal tired because I can't chase after the toddlers. So this is really, really significant stuff. And you know, they say when we're learning in school, they say the patient will tell you what's wrong with them. You just need to listen. It's very true. You actually need to listen to everything they're saying, right? And really actually listen. That's the key, okay? So that was the take home on her, and she ended up having to get a bypass. So can you imagine being 38, a school teacher, and thinking that you're gonna get a Z-Pack and you go home with a bypass? The happy ending to this, however, is that this patient, thankfully, it was caught. And thankfully, she got her cabbage and she wasn't referred to cardiology as an outpatient and left in the wings for 3 months while she was waiting to get into clinic. I was just teaching right now at a conference. I'm down in San Diego teaching, and I just got off the stage and somebody pulled me aside and he said, I work in, I won't say where, but it's in our state. And he said, I'm appalled at how long it takes to get people into specialists. And you told me how long it takes, months. And I said, you're not alone, friend. It's that way everywhere right now. And in my area too. So can you imagine if this patient, we referred her to cardiology because of an abnormal EKG, because of non-specific ST wave changes, what would have happened to her? I guarantee you she would have died. So it's not that I want to end this on a heavy note, but I want you to understand that this stuff, knowing, oh, it's a STEMI or not a STEMI, is unfortunately not enough. We need to know the details. We need to know these little things. And that's why I'm glad that you guys have been here for all 5 nights and that you learned a lot of our things that we showed you. I'm grateful for your time because I know that your time is precious. I know my time is precious too. But think about this for a second. Think about the fact that I know you guys who have been on with me for 5 nights. I know you saw that I was in my house for the first 2, but I've been in a different hotel room every night for the last 3 because I'm traveling teaching this, because I feel so passionate about spreading the word to everybody I can about this stuff. But just to go back for a second and go back to the paramedic me, I just want to share with you one thing that happened that I shared with you on night 1. But this is that list that I wrote. I didn't show you that list. This is that list. Because I realized that if I didn't pick up the things that would kill the patient and the machine didn't pick them up, then who was going to pick them up? Nobody. It was me or the machine or nobody. So I got really scared and I prayed that the radio didn't go off for the rest of the night. And I stayed up all night writing this letter, this list. And I said, okay, I need to know the high risk things that will kill people. And this is the list I made. And I learned those patterns in and out. And that's what I built the 30-day challenge on. I built it on getting you competent with those findings first so that you were armed and not going to be caught with your pants down. I thought it was really interesting because a different student came up to me yesterday and she's in PA school and she's like, so I wasn't anything medical really before I went into PA school. And she goes, this EKG stuff, this is really hard. How am I going to be doing your 10-step system? And it was really cute. She goes, what if the patient dies while I'm doing the 10-step system? And I was like, that's actually really considerate. You know, that's a really, no one's ever asked me that. And I said to her, I was like, well, here's what I would do if I were you. I wouldn't try to eat the elephant. I told her I wouldn't try to eat the elephant. Don't learn everything right now. Don't learn everything at once, right? I said, if that's worrying you, go home. And I gave her this list. And I said, go find out and memorize these findings. And then your patient won't be dying while you do your 10-step. And she was like, okay, I feel a little bit better. But anyway, I digress. So for those of you who have been with us for all 5 nights or even just popped in, I did want to say, actually 2-to-1 flutter. Robert, that is on my list, actually. 2-to-1 flutter that looks like sinus. That is one. And that's such a good point, Robert. I'm glad you shared that with me. Robert is a longtime medic, by the way, for those of you guys who don't know. But for those of you who have been coming and giving us your time, sharing your thoughts, being vulnerable, answering the questions, and being with us, I'm super grateful. And I know Michelle's grateful. I know that David's grateful. And we're really happy that you spent all 5 nights with us. Kaylee, as a paramedic, how do you get a provider to take you serious? Okay, yeah, good question. So Kaylee, let me talk about that since you had a question. Kaylee says, how do you, and Kaylee, you're in the 30-day EKG challenge now, so you can literally, this study hall, David, maybe you can address that because David's a paramedic and he can give you how he deals with that. But let me just tell you the truth, okay, Kaylee? And I know David will back me up on this, and probably Robert too. But the reality is that if you know how smart David is, and I know you've already gotten to see how smart he is. I know, David, you hate when I say that, but David's really smart, okay? If David walks in with a patient and he says, yeah, I got a D. Winters or I got a Wellens, right? Something that hardly anybody knows about, and he gets pushed off to the side, like you said you feel, Kaylee, then it happens to everybody. I mean, if it happens to David, it happens. It's kind of like, to make an analogy, like think about Halle Berry, right? Halle Berry is beautiful. Halle Berry got cheated on by her husband. If it can happen to Halle Berry, it can happen to anybody. It's like that. Not to make that awful analogy, but it happened to me too, Kaylee, just to give you personal experience. I remember being 13 years as a medic in and thinking, my goodness, have I not earned my boot stripes yet enough for you to, if I'm bringing in a respiratory patient, for you to believe me? It's just how it is, Kaylee. It's like that. It is everywhere. And tell me if I'm wrong, you guys. But what you can do, Kaylee, is you can learn these things in the 30-day, and see Robert agrees. Learn these things in the 30-day that maybe even the docs don't know, and then go back in and bust out the new terminology that you're learning and see how they look at you then. It will probably be different. So giveaway time, I'm gonna do that in a second, you guys. We're gonna give away some badges and some mug rugs. But in the meantime, for any of you that want to take the journey with us and keep on going in the 5-day, just continuing on in our 30-day EKG challenge, I'm going to show you a little bit about that, and then I'll do the giveaway and we'll wrap up the evening. So I showed you this in the very beginning, okay? And this is the basics. We learned a lot of this already, the waves, the rhythm, the intervals. We talked about that night one. We talked about what a normal EKG looks like. And Michelle kind of covered a little bit on what the 12 lead looks at. But then we kind of crossed that bridge into starting to know and layering on additional things, like understanding coronary anatomy and how that corresponds to the EKG, learning the high risk patterns, which you kind of talked about, talking about STEMI, talking about mimics. And that's where you start feeling the rubber meet the road and you start feeling confident. And that's what happens in the 30-day EKG challenge. I see Sarah just logged on. She's in our 30-day with us. And actually, I've seen a lot of our 30-day people on with us today, which just goes to show you that even if you're in our 30-day, there is value in this 5-day EKG challenge. We're not holding back the good stuff. There's just more stuff. That's what we do in the 30-day. But you go from feeling scared, like stuck, like you need help, and we put you through a program where we do the basics with you. We do arrhythmias. We do hands-on workshops. We do study halls where we customize the classes to what you need. And we do live classes. And you get to be in our group for 6 months, actually 2 of our groups. And wanting it isn't enough. It's actually committing and saying, yes, I'm going to show up for my patient so I don't miss this. I'm going to show up for my family so I don't get sued. I'm going to protect the license that I worked so hard for by knowing the things, okay? And you get access, like I said, to our 30-day EKG Facebook group where we do all our live classes. If that you can't make it, that's fine. We record it. You can watch it later. In fact, there's 2 years of things that are recorded. So if you come in and you're like, hey, I want to watch something on Scarbosa's criteria. Okay, we'll tag you in Scarbosa's. Hey, I'm a paramedic and I need med math. Okay, we'll tag you in Sean's class that he did on med math. And we'll tag you in the workbook that goes along with it. Hey, I'm a baby PA or a baby medic maybe. And yeah, so I just need the waves. I just need to learn about those. I just want to start at the baby steps. That's cool, we got you. We'll have you start in the HK Launchpad and we'll tag you in those basic courses, right? You're going to get sent a kit by John. He's actually mailing them for me because I'm out of town. So they're being lovingly mailed by my husband. And this is the classes that are the CE courses. So these are already going to be, as soon as you sign up, you're going to get instant access in your learning portal with these classes. This is what our CE, our 12 hours of CE is based on. But everything else is gravy. Like literally, if you only watch these and turn in your CE, you could be done. But everything else we do live as gravy, as bonus. So one of our 30-day students, she messaged me yesterday and she said, hey, I can't make it to class. And I was like, that's okay. You never need to tell me. None of it's mandatory. And she's like, oh, I didn't know that. And I was like, yeah, I think a lot of people think that. And they're like, oh, I'm too busy. But the thing is, come for what you want. Come pick out what you need, what you want. And like literally just up in week 1, we start off next week, Monday, with EKG terminology and our welcome call where we show you around the Facebook group. Then Michelle's going to throw you through some arrhythmia practice because we didn't really get enough arrhythmia practice with Gary to get confident. So Michelle's going to do that. We're going to get study hall with our brilliant medic, David, on the 11th, and he's going to do customized lecture to what you guys want to learn about. And then David or Michelle's going to do some 12-lead basic where she's going to show you the anatomy, the cameras, and do the heart voices and make it super easy. And then on Saturday and Sunday, we got you lined up with basic arrhythmias and a 3-hour hands-on workshop. This is the one I'm going around the country teaching right now. You're going to get that as part of our program. Yeah, people pay $150 to come see this live. you're going to get it as part of your package. So that's super cool. And you can watch it over and over and record it if you want to. So here's our lineup, the schedule, and all times are Pacific Standard. We even have this time around, and next month in November, you'll still be in with us. And we have 2 study halls with our coach, Megan, who's our cardiology queen. And she basically, like, you give her a topic, she covers it. She does inpatient and outpatient cardio, and she does anything you want. She's done heart failure for us. She's done stress testing, how to pick a stress test, how to answer triage messages, how to read Holters. Like, it's all already recorded in our group. And there's so much more. And I don't want to bore you with this. You can actually look back at this later, but we're going to do cardiac farm. Michelle does a lot of things on the anatomy, and you're going to get to interact with her just like you did tonight, which is so, so fun. We go on into November. We do Whitney lipids, and we also do, and Whitney, just to tell you, she does amazing lipid work. She's a lipid NP, and she talks about all the ways to get the new meds covered, talks about how to do advanced lipid testing, what statins are strong and what statins are weak. What do you do if the patient is unfortunately intolerant to statin? What do you do? How do you document the chart so you get it or how do you get it covered? When should you actually stop a statin? What CK is too high? How does vitamin D play into all that? So she talks about that. And then we're going to finalize it with a wrap up of arrhythmia practice where I'm going to run you through arrhythmias. And that's just this 30-day, right? You're going to be in it for the next 30-day with us whenever we start that. And you'll get continued ongoing support. So Gulima, Tori put the link for you, or Zulima, we would love to have you in the group. The link is right above your comment in Facebook. And literally, guys, the great thing about this is that we're just people. We're just providers. But we're trying to bring you with us. We're trying to share with you real world experience. We all work, and Michelle still works too. Yeah, but she's, works tirelessly. And she still actively works as an RN as well. But we all bring real world experience to you, and we're in the trenches with you. So we're not like these on a pedestal people. We're just real providers with you. So these are all the things that are in the past 2 years you'll get access to. You can see Michelle did an LVAD and how to make sense of echo reports, the new CHF guidelines, the new drugs, deep dive on anticoagulants. There's so many good things that are already waiting in the group that you could literally join tonight and watch. So you get an EKG workbook in your kit. You get this kit here, right? It comes with all these fun tools and things. You get all the courses for the last 2 years. So it's like kind of self-paced, but also whatever live pieces you want. You get a free painting that I've custom made just for you, and literally no one else will have the same painting. And that all gets mailed out to you, priority 2-day mail. And you only need this by the 16th. You don't need it any sooner. So like if you decide Monday you want to join, you're like, oh, I want to get paid Friday, I want to join Monday. Fine, you'll still get your stuff in time. You additionally have access to our sleep medicine queen, who is Carissa Hankins. She's a sleep NP, and she's done so many sleep apnea lectures for us, and will continue to do them ongoing in our group. But she's a great resource for all those pesky sleep apnea questions. And this is our beautiful lipid queen, Whitney, and she's just amazing. And so all these lectures are already in the group waiting to go, including a valve disease lecture or 2. So literally what you do is you click the link and you pick, hey, do I want to join and get CE 12 hours? Cool, you pick your position. If you don't want CE and you don't need it, then you can get in as a student rate for only 127, which is a steal. 6 months for 127. Is there any courses that you can join right now? Think about this, where you get live support from not just one coach, but many coaches, and also 2 years of recorded material. There isn't. And that's why we made one, because we were like, this is a need, right? So Murmy's gonna welcome you into the group, my German Shepherd. You're gonna get a receipt, you're gonna get your package, and you're gonna basically come to our welcome call. And if you can't make it, it'll be recorded and you watch it later. No big deal. We kind of show you where things are. And then we'll do a bunch of bonus sessions. So how can you join to get in? Tori's going to put the link for you guys so you can click on it. And if you're joining us, if you've already joined us, welcome in. You're going to love this experience. It is unlike any other. And to have the access to the coaches is really amazing. And also, the people in the group are really friendly and welcoming. And that's one thing that we were like, we want to guard this with our lives, because we don't accept anybody being mean or being any less than respectful when people are learning. And everybody has that mentality, and all the coaches do too. We all think alike. So if you want to join us, we would love to have you. The link's being posted by Tori. But now I'm going to give away the prizes. And so we've got all your names here. We're drawing for mug rugs and badges. And yes, David, the best thing about this group is you can feel free to ask anything without being looked down. Yeah, that's the thing that I love the most about our group, is that we are such a supportive crew. I have chills right now thinking about it. Honestly, just a side note, I dreamt about making something like this like all my life, because it's what I wanted when I was a baby medic, and I didn't have it. So we created it now, and hopefully you guys can all learn. And I know Michelle had the same thing, where she didn't feel like she got a whole lot of support when she was first starting. And so we kind of like turned that around, and we're like, yeah, it's not going to happen to our people. So let's do the drawing. So we're going to draw first for Michelle's mug rug. So the first mug rug is for Marcia Bowles. Marcia, I know you're in our 30 day with us. You joined us, sister. Best decision you ever made. And why don't you send your address to Michelle so she can send out your mug rug? So Marcia, congratulations. Yay, Marcia. Okay, the next mug rug from Michelle is going to be, I have two. Okay, the next mug rug is for Karen Thrasher. So Karen Thrasher, congratulations. You have the next mug rug from Michelle. So send your address her way. So Karen and Marcia, congratulations. And the third mug rug is going out to Kaylee Kraft, who I know is on Zoom with us. Kaylee, what's up, girly? Strong work. Okay, so that's our 3 mug rugs. And then we're going to give away 2 badges. Okay, so badge number 1 goes to Susan Bowman. Susan, girl, I've seen you on live with us every night, and you absolutely are getting one of the badges. So message me, Susan, message me in Facebook Messenger your address so I can get that out to you. And our last badge of the night is going out to, oh my God, I can't read my writing. Monique M. I think that was Monique Miller. So Monique Miller. So Susan and Monique Miller, I believe, Monique, you are on Zoom. So yes, you guys are the winners of the EKG badges. So get me your address. And finally, without any further ado, I'm gonna just stay here if you guys have any questions. And come up, feel free to come off mute or type in the chat if you have any questions at all. And thank you guys for being here for our 5-day. I hope you learned a lot. Also, if you want to watch the replays like over the weekend, there is a replay link, but also the replays get put in the guides section when we're done. So they're in 2 places. We have a replay page and the guides section at the top of the group. And David is here too, and he's here to answer questions. So this is your chance. If you have any questions, to please, we've got Michelle, David, and me, our undivided attention, if you guys have any questions or comments.
Hey guys, if you got a mug rug, message me in the private message and tell me if you're a paramedic, if you like cats or dogs, and or if you're a nurse, PA, nurse practitioner, or what you do, because I'm going to make some more mug rugs this week, so I'll have all those done.
You're the best, Michelle. She hand makes them for you guys. So honestly, so how do I send a message to Michelle? Marcia, Michelle will reach out to you. Candace, how do we receive a certificate for CME? I'm going to be posting the link as soon as I get off of here, Candace. It will be a post in the group. And what you'll do is you'll go to there's a post-test evaluation, and there's also a test, like a 5-question test. You'll fill those out, and as soon as you do, then we'll, like I said, give us a little bit of a turnaround, and we'll get those certificates out to you. So if you're a PA, NP, or RN or EMS, we have CE for you guys. So thank you guys, and thank you everybody who's been here. And Kristen, we're congratulating you because I know you joined us in the 30-day. Your kit has been mailed, by the way. I'm very excited to have you as part of our crowd. Yeah, so if there's any questions, let us know. Even if you think of something later. Otherwise, we'll let you guys go for the evening. And thank you, Tori, for posting the link for everybody. So we've had so much fun. Michelle, any closing thoughts for anybody?
No, I think that's it.
Yeah, this was a lot of fun. We know that it's a big time commitment staying with us for 5 nights, but man, we had a lot of fun. So thank you, everybody. And hopefully we'll be seeing you on Monday at our welcome call on 5:30 Pacific Standard Time.
Bye,
Bye.
guys.